Artificial Intelligence Dr. www.abcpharma.net/English. User question. Do patients with LBBB and leadless pacemakers who don't experience initial QRS narrowing have different long-term clinical outcomes, e.g., heart failure progression, mortality, compared to those who do show QRS narrowing? Claude AI answer. This is an excellent and nuanced question that touches on an important aspect of cardiac electrophysiology and patient outcomes. To answer this, we need to consider several factors. 1. QRS narrowing as a surrogate marker. QRS narrowing is often used as a surrogate marker for improved ventricular synchrony and potentially better outcomes. However, the relationship between QRS narrowing and clinical outcomes in leadless pacemaker patients with LBBB is not as well established as it is in cardiac resynchronization therapy, CRT. 2. Limited long-term data. Leadless pacemakers are relatively new technology, and long-term outcome data, especially in LBBB patients, is still limited. Most studies have focused on short to medium-term outcomes and safety profiles. 3. Potential differences in outcomes. Theoretically, patients who experience QRS narrowing might have better outcomes due to improved ventricular synchrony. This could potentially translate to slower progression of heart failure, improved left ventricular ejection fraction, reduced hospitalization rates, potentially lower mortality rates. 4. Factors influencing outcomes. Pacing site, apical versus septal, percentage of ventricular pacing, underlying cardiac disease and comorbidities, age and overall health status of the patient. 5. Comparison to traditional pacing. Some studies suggest that leadless pacemakers may have better outcomes compared to traditional transvenous systems, regardless of QRS narrowing. This could be due to reduced complications like lead-related issues and infections. 6. Need for further research. Prospective, long-term studies specifically looking at LBBB patients with leadless pacemakers and correlating QRS narrowing with clinical outcomes are needed. Such studies should stratify patients based on whether they experienced QRS narrowing post-implantation. 7. Individual variability. Some patients might show clinical improvement even without significant QRS narrowing, while others with QRS narrowing might not show expected benefits. 8. Alternative markers. Some researchers suggest that other markers, such as left ventricular activation time or mechanical dysynchrony indices, might be better predictors of outcomes than QRS duration alone. While the current evidence is not conclusive, it's reasonable to hypothesize that patients who experience QRS narrowing might have better long-term outcomes. However, this needs to be confirmed by dedicated long-term studies. It's important to note that clinical decision-making should not be based solely on QRS duration, but should take into account multiple factors including overall clinical status, echocardiographic findings, and patient-specific considerations. Given the complexity of this topic and the evolving nature of leadless pacemaker technology, clinicians should stay updated with the latest research and guidelines in this area.